companies that provide services that have existed forever, that are wanting to provide services in the same manner that they've always been provided with the same compensation. A lot of those fall into healthcare. I've been in healthcare for 23 years. I'm going into my 23rd year. And one of the issues that I'm routinely hearing from previous colleagues in different industries, maybe they're still in the service industry, they've moved on, but the message has been the same, that the companies, the healthcare companies themselves, basically want the same business they've always gotten at the same revenue reimbursement that they have always received, and that they want the numbers to continue to grow. Someone is listening and going, well, that makes sense, right? Yes and no. This is where market analysis and taking things into consideration, like the fact that a market has changed, makes sense. Is when you look at healthcare specifically, it's not like it used to be. The patients have changed. They're younger. They're sicker, which also means that they have different benefits because insurance has become so expensive. You have more and more younger members who are choosing not to carry insurance because they simply can't afford it. I was talking to someone last week whose premiums, and they're a family of four, was $480 a paycheck. That adds up. And then sometimes they don't use them. And so then you start to look at how much of that money could I put back into my household and use for other things, and maybe just set up a little fund to where I'm sliding so much money a month in, but not as much as I was paying in premiums, into this account, so that if the kids need to go to urgent care, I can pay out of pocket, which is going to be cheaper. That's a whole nother video. And I can pay for it because I'll have a fund set up. So those are for the families that have been paying for insurance. So you've got younger demographics, sicker, choosing not to pay for insurance because they merely can't afford it. Because let's be honest, most people aren't even making a livable wage anymore. And so then they're looking at, because things like oxygen and equipment, then that's not covered. And so then they're having to pay out of pocket. I just really don't need it because I don't have coverage. And if I do have insurance, chances are it's not going to cover what I need anyway. And so what that does is that impacts every home health agency, skilled nursing facility, inpatient rehab hospital, assisted living, because people aren't spending the money to go in, independent living because they're not spending the money to go in, because maybe they're moving in with a loved one and they're paying them so much on their rent because it makes it easier to run their household. There's a lot of factors that go into that impact healthcare directly. And so the message, the takeaway, isn't just for the representatives in the world like myself, it's also for the business owners like myself who can sit there and say, maybe we need to readjust the way that we do things and look at reimbursement a little bit differently and figure out how we can actually make this lucrative for our employees and ourselves while taking care of the current population that actually exists, and get away from the old ways, because the old ways don't exist anymore. Pre-COVID numbers and data don't exist anymore. The COVID data was temporary and doesn't do you any good now. It is new. You started over after COVID. Anyway, I could talk about this all day long, but I gotta go. Have a good day.